One of the major culprits in arm injuries was the inability to withstand the force after the delivery of the baseball on the shoulder of the pitcher. We call this the deceleration phase of pitching. And interestingly, this phase of pitching goes unnoticed in terms of a game or in terms of the game's context. So if a pitcher has fatigue in any other part of their body along the kinetic chain, so if their legs are tired, they may lose some velocity and command. If their arm is tired when the acceleration, they may lose velocity and command. If they're generalized tired, they will probably lose some velocity and command. But if they can push through that fatigue and continue to be successful on the field, those areas of fatigue generally don't lead to injuries. However, when the deceleration muscles are fatigued, if they're fatigued before the other muscles, it will go unnoticed. The pitcher won't notice it, the coaches won't notice it, the hitters and the catcher won't notice it. So they will be able to continue to pitch despite that fatigue. As a result of that, we started to see adaptations around the shoulder. Now, we didn't know why we were seeing those adaptations. We've seen them for years. We saw flexion contractures. We saw posterior capsular thickening and tightening. We call it the Bennett's lesion in orthopedic surgery, a thickening in the posterior aspect of the glenoid. Research was done trying to distinguish if this was due to a ratio of our arm strength between our shoulder accelerators and decelerators, or our internal rotating muscles versus our external rotating muscles. And in all of the research to try to pinpoint this, we're always trying to isolate a specific muscle group, one muscle or another muscle. And we're doing it with handheld dynamometers, which lead to some inaccuracies and don't necessarily measure the pitcher in what they're doing, which is pitching. So as I went through my practice, I started to see more and more patients with superior labral tears and scapular dyskinesis, the scapula being the large bone on our upper back that the muscles that support the shoulder are based off of. And we'd see that scapula drifting, and the muscles around the scapula were training players constantly to maintain their posture, to maintain that strength. We could look at players and see one shoulder sitting higher or lower than the other, and we knew that wasn't good, but we didn't understand exactly why it was happening.